This is Dr. Ananya. Welcome to my channel. In today's video, we'll be talking about Chikungunya test. Before beginning the video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is this test. Chikungunya is a mosquito-borne viral disease. It is characterized by sudden high fever and severe pain in the joints. In 2016, there were 1.25 million of chikungunya cases in India. This virus can be transmitted by mosquito bite, maternal fetal transmission, or organ transplantation. Now let us see what is this test used for. This test is used to detect anti-chikungunya antibodies in the body. The presence of these antibodies may indicate that there is active infection of chikungunya. You may require this test if you have signs or show symptoms of chikungunya. The symptoms of chikungunya usually appear from day 3 to day 7 after the mosquito has bitten. The common symptoms of chikungunya may include sudden high onset of fever that may reach up to 104. It also includes severe joint pain, rashes, red eyes, and headache. So if you have any of the potential risk factor and any of these symptoms, your doctor will require this test to confirm the diagnosis or rule out the diseases. So now let us see how is this test done. For this test, a small sample of blood is withdrawn from the vein of your arm. The sample is then collected and sent to the lab. The results usually come in 2 to 3 days depending on the lab. There are almost no preparations needed for this test, but make sure you inform your doctor about all the medications that you are taking, including the ODCs, that is over-the-counter pills. Are there any side effects or risks to this test? There are almost no risks or side effects to this test. But make sure the needle is sterilized and the area is well cleaned. Now let us talk about the results. The symptoms of dengue, Zika virus, and chikungunya are almost similar. So, this test will look for anti-chikungunya antibodies to check the presence of chikungunya. If a test result is 0.79 or anything less than this, it indicates the absence of chikungunya virus. If a test report lies from 0.80 to 1.90, it indicates a possible presence of chikungunya virus. Now, depending on the test reports and the symptoms, your doctor will talk with you to develop a treatment plan that works best for you. Sometimes your doctor will also require antiviral test, that is RT-PCR, to check the presence or confirm the presence of the virus. It is important for you to talk to your doctor or consult your doctor before interpreting any report by yourself or starting or stopping any medication. It is equally important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided in the description below. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.